Good day, ladies and gentlemen. I am by name Michael Innocent Linus from Taraba State University, Jalingo, Faculty of Health Science, Department of Public Health, 300 level, representing Group 7 in Seminar 3 on malaria prevention. Stay tuned. In the next few minutes, we are going to be introducing you to the work proper. Firstly, looking at the table of content, these are the list of things we are going to cover on this program. That is from the introduction, number 2, definition of terms, and number 3, we are going to know about what malaria is all about, and then we are going to know the types of malaria parasite that disturbs us as human. Then at number 5, we are going to look at the causes of malaria, what makes us to have malaria infection. Then the incubation period of malaria, which is the next. What do we understand by incubation period? We will know it once we get into the program proper, and also the signs and symptoms of malaria. Then number 8, the mode of transmissions of malaria. Also, we're going to know all about this and the risk factor associated with malaria. Then number 10, we're also going to look at the prevention of malaria, how we're going to prevent ourselves from getting malaria infection. Then number 11, we're going to look at the benefits of malaria prevention. What will you achieve when you prevent yourself from malaria? All you're going to know it at the end of this program. Then looking at number 12, we're going to know the challenges, what makes us to have difficulties in preventing malaria. All we're going to learn about it. Then at the end of the day, we'll come up with something good to understand from the summary and the recommendation. Then looking at the introduction, malaria is a disease caused by the parasitic protozoans known as Plasmodium. It is a vector-borne disease which is transmitted from person to person through the bite of an infected mosquito. This is to say that malaria is transmitted through the bite of a female Anopheles mosquito. When the mosquito bites a human, the infected parasite bites a human, that's where we get malaria. Control measures include insecticide-treated net, bed nets, and indoor residual spraying with insecticide. Both of those methods target the mosquito vector. You cannot prevent yourself from malaria when you don't use this method which I mentioned, that is use of insecticide-treated net, indoor residual sprays, and others. And the most type of the parasite that infect us in Africa is known as the Plasmodium falciparum, and is more endemic in Africa and mostly affect pregnant mothers and children. Looking at the definition of terms, we're going to look at some various key points to define here, which number 1 is Anopheles. Anopheles mosquito is of a genus which is particularly common in warmer countries and include the mosquitoes that transmit the malaria parasite to humans. Then health. Health refers to the state of complete physical, mental, and social well-being of an individual, and not merely the absence of disease or infirmity. Then looking at the definition of parasite, which is seen as an organism that lives in another organism called the host and often cause harm. Then incubation period is defined as the time from the moment of exposure to an infectious agent until signs and symptoms of the disease appears or manifests. Then definition of vaccine. What is vaccine? Vaccine refers to a suspension of weak or killed microorganism that is administered primarily to prevent disease. Looking at the types of malaria parasite, we have 5 species of Plasmodium that causes malaria or infections in human. Number 1 is Plasmodium falciparum. Number 2, Plasmodium malariae. Number 3, Plasmodium vivax. Number 3, Plasmodium ovale. And number 4, Plasmodium knowlesi. The Plasmodium falciparum is potentially life-threatening in humans. Causes of malaria. You get infected with malaria when an infected female Anopheles mosquito infected with the parasite bites and transfers the parasite to you. Malaria is spread when an infected female Anopheles mosquito bites a person. Incubation periods of malaria. Just as we defined it earlier, the meaning of incubation, the incubation period of malaria ranges from 12 to 30 days before the manifestation of signs and symptoms of the disease. Signs and symptoms of malaria. These are what you see when you get infected with malaria, that is after the incubation period of 12 to 30 days. These are things you will notice in your body that will make you understand, or that will make your doctor will understand that you have malaria. That is number one, high fever. We have headache. We have convulsion. We have fatigue, joint pain, muscles pain, nausea, and vomiting. Looking at the mode of transmission, uninfected mosquito. A mosquito becomes infected by feeding on a person who has malaria. Transmission of the parasite. If this mosquito bites you in the future, it can transmit the malaria parasite to you. This means that an uninfected mosquito cannot transfer the parasite to a healthy person, except an infected mosquito who has gotten the parasite from an infected person that can transfer the parasite or can infect another person with the same malaria parasite. Risk factors. People at higher risks or people at risk of serious malaria disease include young children and infants, older adults, travelers coming from areas who have no malarias or immigrants, pregnant mothers and their unborn children, and also people with HIV. These are the group of people that are of higher risk to malaria infection. Malaria prevention. Under malaria prevention, we have listed things that you should do and know that will help you prevent you from malaria. Number one, that is use of anti-malaria drugs. Anti-malaria medicine can also be used to prevent malaria. That is drugs like Maldox, ACT, or Artesunate. Those are some of the medications to use that can treat malaria and also help you from preventing malaria. For travelers, malaria can be prevented through the use of chemoprophylaxis and pregnant mothers living in a moderate to high transmission areas. Number two, use of insecticide treated net. Sleep under a net, a bed net, particularly those treated with insecticides such as permethrin, which helps prevent mosquito bite while you are sleeping. As you can see an example from the image projected, that this woman and her baby, they are actually under the mosquito net sleeping perfectly, and the mosquito net is not touching their body either, that is preventing them from a mosquito bite. Number 3, early diagnosis and treatment. Early diagnosis and treatment of malaria reduce the disease and prevent death. It also contributes to reducing malaria transmission. The best available treatment, particularly for fifth falciparum, is artemisinin-based combination therapy, which is known as ACT. The picture is also projected. Once you feel there are signs or symptoms you feel in your body that you're not okay, you quickly run to your doctor. He will run some tests. Then once it's malaria, he will just treat you, and you'll be free from malaria disease. Applied insect repellents to skin. Use an insect repellent registered with the Environmental Protection Agency on any exposed skin. Do not use a spray directly on your face. This means that there are insect repellent that can be used to prevent yourself from mosquito bite, but do not apply those repellent directly on your face, which can cause another different effect on your faces. What you need to do is to apply it on your skin on the other side of the body, or on also your clothing, so that it will help you prevent yourself from getting bitten by the mosquito. And number 5, environmental sanitation. just like cleaning the surrounding, clearing the bushes around, because bushes around the compounds are very good breeding places for mosquitoes. So once we clear the bushes around the compounds and the surrounding, it will help us reduce the number of mosquitoes that get into our compounds and into our rooms that will bite us and infect us with malaria parasite. The next on our prevention list is preventive medicine. That is, if you will be traveling to a location where a malaria is common, you can talk to your doctor or your personal consultant a few months ahead of time about whether you should take drugs before or during or after your trip to help protect you from malaria parasite. There are certain medications which once you are traveling, you can get tested of malaria, and once you are treated, you can take those drugs to prevent you from having the malaria to where you're traveling to. In general, the drugs taken to prevent malaria are the same drugs used to treat the disease. What drugs you should take depends on where and how long you are traveling and your own health. Benefits of malaria prevention. These are some few points that once you help prevent yourself from malaria infection, these are some of the things that we noted on ground that you will benefit from. Number one, it is important to the health of the population. Number two, malaria prevention can lead to economic growth. That is, when you prevent yourself from malaria, monies, resources that you're supposed to waste in treatment and other things will be used to grow your economy. Number three, it prevents anemia in pregnancy. Number four, it reduces household health expenditures, because once your children or your family member oftenly fall sick of malaria infection, you must take them to the hospital. But if you prevent them from having the malaria infection, you can use those money to do other things in the family. Number five, it avoid catastrophic, that is a terrible disaster. Example, that is a health expenditures and reduces the burden of the public health system. Challenges to malaria prevention. due to the following beliefs, that is, malaria drugs is expensive, malaria has a spiritual cause, because many people believe that if somebody is sick or has fallen sick, they will say, this one is caused by babalawo or witchcraft. So they will begin to do some incantation and whatever, of which they don't know that it is a common mosquito that bites and infects you with the malaria. Number 3 is beliefs of not sleeping under long-lasting treated insecticide net. Recommendation 1. We recommend the next researcher to take part in complications of malaria and also effect of malaria in pregnancy. 2. We recommend the audience to take actions on adequate environmental sanitation and proper use of residual spray. 3. We recommend the government to introduce good strategy concerning the recently approved malaria vaccine by World Health Organization.